Good afternoon, everyone. I'm Dr. Raghav MALIK. I will be presenting my results on comparative study of the Tecnis Eyhance Toric 2 with the Alcon Clarion Toric in cataract with astigmatism. Okay, so current day monofocal IOLs have their own limitations, of course. We do get very good vision quality for distance, but for intermediate as well as near, we are lacking. So the patient can get spectacle free for distance, but requires a multifocal lens for or an EDOF lens for intermediate and near. But we know that the trifocal lenses or multifocal lenses come with their own set of demerits, including decreased contrast sensitivity, increased dysphotopsia, and around 7% patients have to go for an IOL exchange if there are, and also some patients also resort to suicidal thoughts in case the dysphotopsias are very high. So there are no known cases of IOL exchanges with monofocal plus IOLs. So this is again a comparison between the EDOFs, monofocal plus lenses and trifocal lenses. We can see dysphotopsia is highest in trifocal lenses, and the patient satisfaction in a monofocal plus lens where you are getting good vision for distance and for intermediate is very, very high. So this is how we as a society have progressed from the 1950s to the current. So if you see this screen, you will see all images where there are only things that have been done for intermediate or distance, nothing for near. And of course there is no screens. From this we have come to a society where most of our lives are restrained around the 80 centimeter zone. Be it driving, you're driving and looking mostly at Google Maps and not on the road. So that's why this is a study to compare a monofocal plus with a monofocal lens. So the study was a prospective randomized interventional study with 70 eyes, 35 patients underwent cataract surgery with the Tecnis Eyhance Toric and 30 with the Clarion Toric. The patients had cataract and regular astigmatism, and irregular astigmatism was excluded. So standard phacoemulsification was done for all patients and standard toric implantation was done. Follow-up was done on day 1, 1 week, 1 month and 3 months. So the purpose was to compare the rotational stability, safety and visual outcomes of the Eyhance Toric with the Clarion Torics. So we use a simple bubble marker, no fancy instrumentation. Patient was made to in a sitting position. The 0 and 180 was marked, and similarly the lens was placed as per the toric sheet. So the observations, the male and female ratio was similar in both groups. So mean pre-op refraction in either group was minus 1.25 and minus 1.2, which was majorly similar. This is the mean post-op refraction. Eyhance was a minus 0.05 and the Clarion was a minus 0.07. Again, both were very, very good for distance. This is again the visual acuity for distance, intermediate and near. So if this is how we compared the IOL stability in the post-op period. The patient was, a clinical photogram was taken, a 0-180 reference line was drawn on the 0-180 mark, and the lens positions were marked with a black dot. So this is the angle which was measured with a protractor, and this was seen as various follow-ups. So rotational stability. So the mean toric misalignment at 3 months for the Eyhance Toric was 2.1 degrees and for the Acryol Toric was 2.9 degrees. So this was insignificant statistically, but there was a slight rotation in the Clarion Torics compared to the Eyhance. So the rotational stability of both IOLs demonstrated excellent stability. The Eyhance had a better stability compared to the Clarion Toric. Both groups achieved similar post-op refraction. So this is how you compare for distance, intermediate and near. So the Eyhance lens actually has an increasing power from periphery to the center. That's why it is giving a small amount of near add within the central 2 to 3 millimeter zone. That gives a very good vision for distance as well as intermediate, and decreasing the need for near add. So this is how, if you see, compare the distance, both the groups had 6 by 6 at 3 months. For intermediate, 6 by 7.5 for the Eyhance group and 6 by 9 for the Clarion group, and for near 6, 9 and 6, 12. The need for near addition in the Eyhance group was about 1.4 diopters of plus power, and for the Clarion Toric was 1.8. So that even if you do a micro monovision with the Eyhance lenses or with these lenses, you can achieve virtual spectacle independence. So to conclude, both IOLs provided excellent post-op visual outcomes and stability. The Eyhance lens as a lens demonstrates superior visual performance requiring less near add than the Clarion Toric, and the Eyhance Toric could be a better choice for patients seeking enhanced near vision without the need of additional correction. Thank you.
So your intermediate and near comparison, was that statistically significant or not?
That is, sir. Yes, sir. Only the for rotational instability is insignificant, but the significance does come for the near ad as well as the intermediate vision, sir.
But the difference for Raghav, difference for near was only 1.4 diopter requirement for Eyhance and 1.8 for Clarion.
Yes,
But
so that's almost a 0.5 diopter, so that gives us enough depth of focus for the patient to be virtually spectacle free. So for a normal monofocal lens, you would probably have a +2 or a +2.25. If from that we can come to a 1.5, that's a game changer for the patient. So in our practice, we're not even advising a monofocal lens. That's totally cannibalized by a monofocal plus lens. Because there's no loss of vision, no dysphotopsias. The patient just gets an added advantage of that intermediate vision.
Okay.
Thank you, sir.